Hi, I'm Dr. Susan Ramirez-Chung here at Fairmount Pediatrics, and today I'd like to talk a little bit about when to know whether your kid needs to go to the ER or make a same day or next day sick visit with us. So whenever we think about our poor kids being sick, we want to look at the whole picture. A lot of us get concerned about fevers and things like that, but we want to focus on really keeping in mind the whole picture. So let's take, for instance, a fever. For any kid who is over the age of 8 weeks old, there is no specific number that urges us to send you guys to the ER. So if there's 3 days of fever or more, then absolutely come bring the child in for a sick visit. We can see what's going on, maybe do some testing if needed. Absolutely bring them in if it's been 5 days or more with a fever of any age. For anyone under the age of 8 weeks, they should be seen by a pediatrician or a physician as soon as possible to evaluate for the fever. Fever is an emergency in a newborn. Let's take, for instance, other things that we think about and worry us for whether or not you need to go to the ER or come in for a sick visit. Dehydration, so vomiting and diarrhea. If a child is still able to drink and you can see tears in their eyes when they cry, or you can see loose spit in their mouth, or when you press the nail beds, if it turns from skin color or pink to white and then back to skin color or pink in 2 seconds or less, you're hydrated enough to keep taking care of them at home. Push those fluids, try to keep their nausea at bay. You can always send us a message on the portal to ask us how best to do that. If a child is not keeping absolutely anything down, not even water, they run the risk of dehydration and low blood sugar. Call us immediately, and if we're not available, please do have them evaluated in the ER. For any baby who has not urinated or peed with a wet diaper in at least 6 hours, so that's minimum 4 a day, toddler minimum 3 a day, that's a sign of dehydration. They should be evaluated by a physician. Another thing that comes up in terms of deciding whether your child needs to go to the ER or come in for a sick visit is respiratory distress or trouble breathing. So I want to play a sound for you that would concern me and would urge me to either have your child seen here or in an ER. So if your child is breathing like that with that squeak, your child really should be evaluated in an urgent manner. If it's in the middle of the night, please do seek care at a pediatric ER. If it's during the day, call us and we will bring them in as soon as possible. And if we cannot, then we'll make a referral out to where your child needs to be seen. Other signs of trouble breathing or respiratory distress. Look at your child. Open up that shirt, bring it up, unsnap that onesie. Take a look at the chest. If there are indentations or sucking in of the muscles underneath the rib cage or in between the ribs, that's a sign that your child is working hard to breathe. Another sign is if the nostrils are flaring out and in, out and in. And then finally, see if the head is bobbing forward and back with each breath. That and fast breathing are all signs that your child is having a really hard time breathing. And if you see that in the middle of the night, please go to the pediatric ER. If it's during the day, please call us and we'll get you guys evaluated as quickly as possible.